going to do a series of just short, very basic films just about a few very common conditions which you tend to see in clinic. Now, even if you don't treat biomechanics or MSK patients, people will still come in with these conditions, and there's a lot you can do to help them. So the first one I'm going to talk about, very, very common, is Achilles tendinopathy. Now, I've said tendinopathy because if I call it Achilles tendinitis, then I'm telling you that there's an inflammation there. And if we're going to diagnose correctly, and if I don't know there's an inflammation, then tendinopathy is a more general term. So try and get into the habit of that. So Achilles tendon comes down the back, very common, as I said. It's not just athletes, not just runners, people that do a lot of sport. You also see it with patients who lead very sedentary lifestyles as well, and you tend to see it with patients with a high BMI. Now, the fibres which come down the back of the Achilles tendon, they don't run straight, they actually spiral at 90 degrees, and that helps the tendon recoil, and it also stores energy. So it's a very, very powerful tendon, but one that gets problems nonetheless. Now, it's not a problem that goes away on its own, and a lot of very recent research which has come out suggests that you need to get loading it straight away, you need to manage the pain, and you need to get them doing some sort of loading exercises. So telling a patient to go away and rest it isn't going to do as much good as you could do with treatment. Now, as far as orthoses go, there's lots of evidence out there for the use or the not use of orthoses, but if we're going to try and manage pain, then an orthosis can be a very useful thing to use. Now, what we're aiming to do with that is get the Achilles functioning within its optimum range of stress. So if you've got a patient that you think is excessively pronating, and you think by adding a device that will help reduce that stress and help you with your loading exercises, excuse me, then it is a very good thing to use. So I'm going to use just a normal 3/4 length bio-advanced device. And what we can do on there, if I think they're excessively pronating, is add a medial post on the back there, and then that will give me some correction to the rear foot and the position of that Achilles to function in. And one of the things you need to watch with this is if they've got tight calf muscles, then they may be pronating or rolling their foot in more to try and compensate for the fact that they have those tight calves. So if you then stop that happening by putting a medial heel post on there, you could end up jamming up the forefoot, and they could be getting problems elsewhere. So always look at the bigger picture. Always make sure when you're treating an Achilles tendinopathy, you're looking at the muscle flexibility in there as well, and looking at what the calves are doing. The other thing you could use in the interim, if they've got a very painful Achilles and you just simply want to offload it, is you can just use a simple heel raise. You might want to do it on both sides, so you're keeping, when they're engaged, so that you're keeping it even on both sides. But you probably wouldn't use this for a long period of time. This is something you might do just in the interim, just to take the pull off the Achilles while you get them doing their loading and while you get them doing their stretching and strengthening exercises. So maybe they'll wear this for a short period of time, and then you take that heel raise away as they improve. Again, with the orthosis, it might be something you just use for a short period of time, and once they're resolved and once they're back to normal activity, then they may not need to wear it anymore. So do have a go at that. As I say, if you get patients that come in with an Achilles tendinopathy, even if you're treating them for something completely different, if they're just coming in for routine foot care, by having a stock of these, there's lots that you can do to help that patient. Okay, thank you.